Radar Healthcare is going to be really helpful in reducing the number of different systems that our teams have to work with. So at the moment we have different systems for incidents and for auditing, etc. And Radar Healthcare will replace those with a single platform where data can be put in and people can compare data from across the different systems and the different modules. So we're really excited about that. It will give us an opportunity for the first time to get some real intelligence and insight into the cross-fertilisation of some of these data streams. So if I think about our frontline nursing teams, we collect quality audit data on the wards, and for the first time we will be able to compare that with our incident data and our complaints data and even our litigation data, and drive out some information about which are our really highly performing wards that we should be looking at and where there are maybe areas that we might want to look at and offer more support to. So it really is a very exciting potential. So we're always trying to improve the quality of care for our patients, and for the first time we have an electronic patient record with lots of interesting and exciting data in. And the way that Radar Healthcare works, we will be able to build dashboards that pull data from lots of different sources together. So if you think perhaps about a patient harm like falls, we might be able to look at the areas that have a large number of patients at high risk of falls, and then the actual falls incidents and the complaints and concerns raised by patients and their families, and triangulate that along with our staffing data potentially into a single dashboard that will tell ward sisters the things they might want to be considering and whether they're doing really exceptionally well and where their colleagues are outperforming them, so that they can talk to them about what they're doing differently. So it'll give us a real opportunity to drive forward improvement and learning. So I think this will inform all of the conversations that ward sisters have with their teams, looking at real information instead of just anecdotal information. They'll have proper numbers and proper information at their ready fingertips, and then when they report to their matrons and the divisional directors of nursing and the chief nurse, we'll all be looking at the same data set really clearly put out in front of you so that you can have a proper conversation about facts instead of just impressions. So it's going to be really exciting. I think one of the big challenges that our frontline leaders have is the amount of actions that they end up with. So you can have actions from complaints responses and from incidents and from improvement work that you're doing, and it can very easily become difficult and unmanageable to keep track of. But with Radar, it will be possible to have a single action list that links to all of the relevant events, and you'll be able to keep track of it and see it on your dashboard and know how you're progressing it and report it effectively to your leads. So that's going to be such a time saver and such an opportunity to improve quality of care. I'm really excited about it.